I made this video for our CREOG review about suture, a fewfold being. One, I think it's an area to get easy points if we review a couple of key vocabulary terms as well as properties about suture. And also, similar to medications, we often only learn the brand names of suture as opposed to the generic terms, so that will be reviewed here as well. The objectives are to review suture vocabulary, describe differences between absorbable versus non-absorbable suture and natural versus synthetic suture, review absorption time versus tensile strength, and then list appropriate suture for different clinical indications in OBGYN. And one thing that's not covered here, as you'll notice, are different needle types, which would also be important when you're calling for suture. Suture vocabulary. Braided or multifilament. So this is a type of suture that several filaments are braided together like a rope. They may also be coated to pass smoothly and often offer greater flexibility in handling. There's better knot security, but can also serve as a nidus for bacteria. This is in contrast to monofilament that's constructed using a single strand of material. You could think of this as like a wire. There's less resistance as this type of suture passes through tissue and tie down easily, but the knots don't hold as well. But there is a decreased infection rate at the suture line. The gauge refers to the circumferential thickness of the suture. The higher the number, the thicker the suture. For instance, 1 monocryl is thicker than O monocryl. But when comparing the zeros, the less zeros there are, the thicker the suture. For instance, 2 ovicryl is thicker than 4 ovicryl. Memory. So the memory is the ability of a suture material to return to its previous shape after deformation. So you could think of this as the stiffness of the suture. And in thinking about knot security, so this is dependent on the force the suture can stand before it breaks when it's knotted. This depends on the suture memory. It depends on the elasticity. And then thinking about monofilament versus multifilament, monosutures again are more slippery and have more memory, but they hold knots less well. Reactivity. So this is the degree of tissue inflammation that happens around the suture, and it's determined by the suture types, and we'll talk about this when we're talking about different sutures. And then smooth versus barbed. So I have a picture here. So barbs are along the length of the suture and anchor the suture in the tissue. It decreases the reliance on knots, as we've seen in the operating room, and also distributes tension across the length of the entire suture. It can decrease the suturing time in some gynecologic surgeries and even cesarean delivery. For those who have worked with one of our attendings, they use this for the skin closure, actually. And then moving on, in terms of absorbable versus non-absorbable and natural versus synthetic. So another few classifications and types of suture. So absorbable sutures are natural sutures that are digested by body enzymes and have more tissue reactivity than synthetic sutures. Synthetic sutures are hydrolyzed, where water penetrates the suture filaments, leading to breakdown. And these absorbable sutures may retain strength for up to 2 months. And we'll go into different types of synthetic and natural sutures and their absorption time versus strength time, strength retention as well. For non-absorbable sutures, they are not digested by body enzymes, hence being non-absorbable. They're used in exterior skin closures for patients with prior tissue reaction to absorbable sutures or as permanent sutures within a tissue. And these may retain strength for longer than 2 months. So we don't often use non-absorbable sutures in OBGYN very often, but as you can imagine, if people are wiring chests shut, that they would obviously need non-absorbable sutures outside of our field. So in discussing the types of sutures, whether it's the generic name or the brand name, so some of these are Ethicon, like Vicryl, is one of the brand names. So for different types of synthetic sutures, absorbable, I'll attempt to pronounce these, but polygalactin is Vicryl, which we commonly use. A delayed absorbable PDS or polydiaxanone. Non-absorbable sutures, nylon, polyamide, proline, which is polypropylene, And then for natural sutures, a little bit more straightforward. There's absorbable and non-absorbable. So absorbable being catgut, either plain or chromic, and non-absorbable being silk, linen, or stainless steel wire. So a question from TrueLearn. A 70-year-old female is undergoing an exploratory laparotomy with total abdominal hysterectomy, bilateral salpingo-oophorectomy, and staging for endometrial carcinoma. She is morbidly obese with moderately controlled type 2 diabetes. She's a lifelong smoker with COPD. Considering the patient is at risk for fascial dehiscence, the surgeon wants to perform a mass continuous running fascial closure using a suture with the strongest tensile strength. Generally speaking, which of the following categories of suture has the strongest initial tensile strength? So I put this question on here because I got it wrong and I think it's a little confusing. The answer is absorbable synthetic suture. And contrary to common belief, the suture with the strongest initial tensile strength, so this is the initial not pull tensile strength, is actually absorbable suture, absorbable synthetic suture. And then this is going to be in comparison to, we're going to talk next about absorption time versus strength retention. So absorption time versus strength retention. And then the E and C here, again, are comparing the Ethicon and there's another brand name suture types. And then in looking at these statistics on strength and absorption, they're the published statistics by Ethicon brand products. So for natural gut or chromic, when we're talking about plain versus chromic, the absorption time in total is 70 days for plain or 90 days for chromic, but the strength retention is only 7 to 10 days for plain or 21 to 28 for chromic. For polygalactin, which is Vicryl or Polysorb, the absorption time is 56 to 70 days with the strength retention, a 50% strength retention at 21 days or 3 weeks. For monocryl, or the polyglycaparone, the absorption time is 91 to 119 days, with the strength retention for 50 to 60% at 7 days. And then the polydiaxanone or PDS, the absorption time is the longest at 182 to 238 days, with a 60% retention time at 6 weeks for the 3.0 or larger. There was also a table in TrueLearn that the question talked about the original, when the suture retained 25% of the original tensile strength versus the absorption time. So a lot of the ones on the left have to do with 50%, but catgut and chromic catgut, or plain versus chromic, 7 or 14 days, which makes sense with the strength retention time that they have, that is listed by Ethicon. And then with monocryl, 25% at 21 days, which is slightly different, which actually makes sense given that the strength retention time for 56% is 7 days. And then Vicryl, 25% at 28 days or 4 weeks. And then PDS, 25% of the original strength at 42 days. Which is slightly different than what Ethicon has listed, but the overall absorption time is approximately the same. So optimal suture for selected clinical situations. I listed this here just for your general review. For those who haven't done a tubal ligation, we use plain gut. That's hemostatic but rapidly absorbable. We want to prevent chronic inflammation and the possible fistula formation or reformation of the tubes. For repair of episiotomy or vaginal or perineal lacerations, I think we largely use Vicryl, but you'll also see chromic being used as well, or Polysorb, which is another brand name for polygalactin. So this has improved tensile strength when compared to plain gut and less inflammatory and reduces postpartum discomfort. These are studies when looking at Vicryl versus chromic for episiotomy repair. For closure of fascia with a low risk of wound dehiscence, Vicryl or Polyzorb, this is the polygalactin if you go back to that table. This has improved tensile strength, but when you have somebody at high risk of wound infection or disruption, such as someone with obesity, diabetes, thinking about the patient in the question, using a suture that has a higher retention time. So this would be like the PDS or the polydiaxonone. Polypropylene is the Proline. We use PDS very frequently, the polydiaxonone, in women with diabetes or repeats for cesarean deliveries. And that's about it. And there is a good module on CREOG, and I listed the website here, which I used for reference. If you also want to review about different types of needle types and knots as well. And then CREOGs Over Coffee has a module about wound healing needles and sutures. And then TrueLearn, I think, frequently has a lot of questions about different types of suture. Hope that helps.